All of a sudden, I started to feel this chest pain in my chest, and I was really nervous. I said, I really have to go home. I'm not feeling well.
She underwent a stress test, and she had the exact same symptom that she had when she was out walking with her friends. And we were monitoring her EKG, and it showed some mild abnormalities, but it really wasn't diagnostic.
My first thought was, what if I'm not here? My family, my husband, my children. It was pretty overwhelming to feel that way.
We sent Kathy to Providence because we currently don't have the technology to do the coronary CTA here in Newport.
Coronary CT angiography is a non-invasive test that visualizes the coronary arteries. It's analogous to an invasive angiogram or cardiac catheterization, but it's done with a CT scanner. It actually takes longer to get to Providence than to perform the tests. I had a patient recently who could not schedule it for a month, and he got into trouble before he could get his CT angiogram completed.
Kathy's CTA confirmed what I was suspicious of based on what she was describing, and the main artery of her heart had a moderate blockage in it.
Dr. Charlton gave me some medications that have proved to be very helpful. This experience has made me more grateful for my health. I know I want to experience more fun with my grandchildren, my husband, my family.
My mom had 2 heart attacks at around my age, and so I think there's a familial history there, as well as on my father's side, hardening of the arteries was like a thing that it's like something that everybody got. Since I compete, and the last time I had my heart checked out was like 2003, I thought it's a good time to get like a stress test done and maybe anything else beyond that.
He had great exercise capacity and everything looked completely normal. But he's concerned about his risk of cardiac events in the future. And that's why he and I discussed getting coronary artery calcium scoring in order to provide additional prognostic information.
Once we established that I was going to get that calcium CAT scan done, we had to figure out where, and I had to make an appointment and find another place.
His elevated calcium score tells us that the process of atherosclerosis and coronary disease is already underway in Tim's heart, even though he's been taking good care of himself. When I discussed the results with Tim, he was really taken aback by the fact that he had early findings of coronary artery disease.
Statins came up as an option, and being the person that I am, tending towards natural, alternative, food-based, I'd like to give that a shot first. I want to move my numbers in the direction that they need to be going. And if they're not, then I will have to consider other options.
All of us know people who have had heart attacks, sudden death, without any of the risk factors. And we haven't had a great way to identify them. Coronary calcium is a demonstrated risk factor, and as of today, it's the best risk calculator that we have.
The lifespan CVI practice here in Newport has been growing rapidly. At this point, we're up to 8 cardiologists who see patients here. We like to keep their care close to home as much as possible.
The hospital recently acquired a CT scanner that has the full capability to perform these tests, but we're missing one piece, which is the very complicated software to enable pictures of the heart.
I'm a motivated person. If a test needs to be done, I'm going to get there. I worry that others sometimes don't follow up on their health the way that they should. Anything that delays or puts a layer or distance and time in between needing to get a test done, and that may put people at additional risk.
One of the major attractions to Newport Hospital is the support from its community. The donors are dedicated to the hospital, they're generous, they take a sincere and detailed interest in what's happening here, and I am incredibly grateful for the opportunity to have them support the CVI and this enhancement of our services here.
As a community, we all should be grateful to have such a wonderful hospital and doctors right here in our own backyard.